She's fierce, she's loving, she's a boss, she's giving sisterhood, support and service. Mocha Mom. She's fierce, she's loving, she's a boss, she's giving sisterhood, support and service. Mocha Mom. She is, yeah. She is Mocha Mom. She is, she is Mocha Mom. Well, greetings, Mochas. This is LaShawn Martin, your National Vice President of Operations. We are super excited that you chose to spend the evening with us. We hope that you are ready for some wonderful information from our NICU moms. But before we get started, I just want to talk a little bit about Mocha Moms Incorporated. Before we do that, do me a favor and light up the chat. Let us know which chapter you're coming from. Let us know which location you're coming from. If you're a guest, let us know what state and city that you're hailing from. Let's light up the chat and get engaged right away. All right, so let's start here. Mocha Moms is the premier voice for mothers of color through chapters nationwide, including Hawaii, and online. Mocha Moms Incorporated provides support for mothers and women of color as they journey through the phases and stages of motherhood while advocating for them nationally. Our focus is sisterhood, support, and service. That is who we are as an organization. We host weekly sister socials, Moms Night Out, social events, conferences, community service events, and much more. To join and be a member of Mocha Moms, to be a part of this wonderful organization that we call Sisterhood, you can go to mochamoms.org. The fee is very nominal, and it takes you throughout the entire year of Mocha Moms, and you can engage in all of our fantastic events that I just mentioned. This evening's topic on NICU moms is one that's very close to our hearts as moms, because our babies, as we know, they are our priority, no matter how old they are, but especially when we're just starting out in motherhood. We are committed to the health and wellness of both babies and moms, which is why we have webinars just like this to share resources and information with our members and guests via in-person events and webinars. Our prior events with the National Institutes of Health, All of Us research program, have included understanding your family, health history, and heritage. You can actually see them here on the screen in just a moment. Also, understanding genealogy and the importance of mothers of color in medical research, and understanding precision medicine and maternal health. You can find these videos by scanning the QR code there on the top right-hand corner of your screen to watch all of the work that we have done with the National Institutes of Health up to this point. But before we jump into our conversation, I encourage you again to engage in the chat. Make sure that you are lighting up the chat, letting people know where you're from, letting them know what chapter you're from. Just simply go down to the chat on your YouTube page and you can engage in the conversation there. We will have Q&A at the end of this conversation, so please stay tuned for that. Now I want to take a moment and introduce our very special guest. Her name is Dr. Kimio Harris Williams. Dr. Kimio Harris Williams is board certified by the American Board of Pediatrics and a fellow of the Academy of Pediatrics. She's an associate professor of clinical pediatrics and adolescent medicine at Louisiana State University School of Medicine and Children's Hospital of New Orleans. Her practice is deeply rooted in patient education and promoting healthy habits, forming the cornerstone of her medical philosophy. A committed health advocate, Dr. Williams empowers her patients and their families to be proactive in health and wellness. A native of New Orleans, Dr. Williams is a proud wife and mother. She cherishes her roles both personally and professionally, finding inspiration in nurturing relationships and serving her community. Her commitment to her family, her community, and her profession is a testament to her passion for creating positive change. So Dr. Williams is actually going to host our event this evening, and I am going to bring her on the screen now Dr. Williams, welcome, welcome, welcome. We are so happy to have you as part of our event this evening.
Thank you so much, Miss Martin, for that warm welcome. It is good to be here. Good evening, everyone. Before we begin, I must share this disclaimer. The views and opinions expressed by the guest panelists and or presenters reflect the views or opinions of the Delta Research and Educational Foundation draft, Mocha Moms Incorporated, and the individual speaker. We are not representing the National Institutes of Health, nor are we speaking on their behalf. It is an honor to be here with you this evening to host tonight's Mocha Moms, NICU Moms, and Medical Research event. An article published in the Journal of Early Human Development in December of 2023 states, and I quote, neonatal care has made significant advances in the last few decades. As a result, mortality and morbidity in high-risk infants, such as extremely preterm infants and those infants with birth-related brain injury, have reduced significantly. Many of these advances have been facilitated and delivered through the development of medical technologies. End quote. This fact alone underscores the importance of research in the field of neonatology and how research can be a catalyst to fuel improved outcomes in NICU babies. This topic is relevant and it touches so many lives directly and indirectly across the globe. With that being said, let us move into our discussion with our notable and knowledgeable Mocha panelists. The panelists include Ms. Daniels, Ms. Purley, Ms. Walker, and Ms. Anderson. Our panelists will share an informative discussion about their NICU experience and their thoughts about the impact of research in the NICU and care of NICU babies. However, before we start our discussion, it would be great to hear a little about each of you and about your NICU journey. Ms. Daniels, can you start us
Greetings,
off?
everyone, and good evening. My name is Michelle Daniels. I am a board certified physician assistant of 15 years. My son was born at 24 weeks. He stayed in the NICU for 3 months, and then he had a medical emergency and then had an additional 2 weeks in the NICU again. I had a syndrome known as HELP syndrome, which is extreme form of preeclampsia, which is life threatening. And so my son had to be born so I can live. Thank you.
Good evening. My name is Shanika Walker. I am a part of the Gwinnett County Mocha Moms. I am the mom of three NICU babies. My oldest daughter, who is 21, I also developed HELP syndrome at 31 weeks with her, and with my twin boy girl, I developed placenta accreta, and I was diagnosed with that in my second trimester.
Good evening, everyone. I'm Shay Purley. I am actually a mom of a 13-year-old, soon to be 14 this weekend, daughter. I am a retired NICU nurse, advanced practice nurse of the military. Army is the branch out of Atlanta, Georgia, South Fulton County, Mocha Moms chapter. I spent about almost 20 years of my career in the NICU, pediatrics, ICU, and the ER. So everything I do is labor and delivery and maternal child. But I absolutely loved my stay in the NICU and loved working with the families and for the military. So I'm here to support all of you beautiful moms with all of your journeys in the NICU. I've been there with you, and I'm here to still root for you. Thank you.
Hi, everybody. My name's Alicia Anderson, and my son was born at 34 weeks. So he spent a week in the NICU. It was really challenging because this was my rainbow pregnancy. So I had a stillbirth the birth prior. And so my NICU journey was extremely, even though it was short, it was extremely painful for me. So I'm happy to be here today.
Thank you all so much for being here and for sharing your story. As you can see, these Mocha moms have extensive lived in NICU experiences, whether it's because their child was in a NICU or they worked in a NICU. And I am so eager to learn more about the transition and about the inspiring discussion that we're going to have tonight. So when you think about the neonatal intensive care unit or the NICU, most moms, physicians, and providers feel a sentiment of compassion and empathy for the patients and their families. This leads me to our first question for our panelists. Um, it's been asked, it's going to be asked with the utmost respect regarding your NICU experience and is centered around emotional impact. The question I pose is, how did you feel when you first learned your baby would be admitted to the NICU?
I think I can start. Of course, it's shocked and worry and fear. I entered the hospital thinking it's just preeclampsia. My blood pressure is high. I can take a blood pressure pill and go home. But the next morning, I awoke and, you know, there was protein spilling in my urine. Things were getting out of control. They were rushing me to surgery, and it became more severe. So immediately, the risk having a child that soon, and it's just no, not me. I've done everything right. I've Why is this happening to me? HELP syndrome is so rare. So it's just immediate, just shock and fear, and just trying to grasp emotions to deal with this situation. But they're running in, reading your risk and rights, and rushing you to surgery, so you don't have much time to comprehend. But immediately, the emotion is, of course, fear and shock, I would say.
Yes, and I can definitely sympathize with that and understand that. Any of you other ladies want to chime in and express how you felt at that time?
I can also say it was definitely it was emotional. At the time of my oldest daughter, I was 23, so I still felt like I was very young. My HELP syndrome came on immediately onset. So one day I was fine. The next day I was vomiting. My blood pressure went up to 217 over 179. I'm in the emergency room and they're telling me you're having your baby today. So I knew she was too early to come, but I knew she had to come. And so they did try to induce my labor, but with, each contraction, her heart rate was going down. So I had to have an emergency C-section. With my twins, because I had already gone through it, I think I was a little bit more prepared the second time around. So even though it was difficult, I understood what the NICU was about and I understood what it would entail.
I would say
So it sounds like, you had some shock and fear as well, um, as a part of, the feelings that you had about, the situation you were in. As a follow-up question, can you all comment on the most challenging emotions experienced during the time that your baby was in the NICU?
I think for me, it was extreme just like disappointment because you think you know what motherhood will entail once you get pregnant and you think I'm just gonna have the baby. So just to have him go into the NICU, I was really disappointed, I think, in myself, because again, I had a stillbirth prior. So I thought I was like in the clear, and then another challenge. And then just really sad that I had to be separated from my baby again.
Yeah.
Yeah. So I hear fear, I hear sadness, all of those emotions. in a, you know, in a time where your emotions are already and your hormones are already kind of, you know, out of whack, so to speak, and just to have to deal with the reality of that um, was a lot. How did you cope with the stress and the uncertainty of having a baby in the NICU? What are some things that you how did you cope with that?
Definitely a lot of praying. You pray a lot. Also just trying to be as involved as I could. Anytime they would let me, spend time with my babies, I was right there. So that time also helped me deal with what was going on, because you're in the process, you're going through, it with your baby as well. But it's definitely a lot of praying.
Yes, absolutely. Praying for me and leaning on family and my support system carried me. So I can attest to that. Having, a faith foundation really helped me.
Okay, thank you. Anyone else have anything to add to that? Well, thank you all for sharing about your emotional impact of having a baby in a NICU. We're extremely happy to hear that you all found ways and resources to cope with this stress throughout that time. Recent research has documented that bonding and caring for your baby, even if he or she is in the NICU, is very beneficial. And as one of you said, connecting with the baby and being there and bonding was a way of coping and dealing with it. So there's an article called A Pivotal Moment in Evolution of Neonatal Care. It was published in April of 2023 in the Journal of Perinatology. And the authors state that, and I quote, there is an abundant evidence for an essential role in a nurturing parent-infant connection for the development of optimal physical, cognitive, and emotional health in all babies. It is a time to leave behind the tradition of sensory deprivation and social isolation common in care of high-risk infants. A paradigm shift is needed in neonatal care to acknowledge the critical importance of infant and family centered developmental care and to remove any remaining constraints on families' ability to become full partners in the nurturing of their NICU newborn. So, this article, and I end quote, talks about that bonding and that caring and how it's so beneficial to the baby developmentally, cognitively, and also to mom. So, can you discuss how did you start the bonding with your baby, even if you couldn't hold him or hear of her right away? How did you start that bonding process?
For me, my hospital actually allowed me to stay extra. So I was supposed to go home like the day after I delivered him, but they had a room available, so they allowed me to stay a few extra days. So I was able to go into the NICU as often as I liked. And even though he had all the cords and machines kind of hooked up to him, we would go in, my husband and I, and we would talk to him and just like hold his hand and just spend some time with him.
So it sounds like the hospital provided an environment for you to bond. The hospital and the medical staff provided that option
Yes,
for
they
you.
did.
Okay, that's good. Any other comments or anyone else would like to
For
share?
me, it was a little different. I had my oldest daughter 21 years ago. So at that time, I could not stay in the hospital with her. Once I got discharged from the hospital, I had to leave each day. There was a time during the middle of the day where you had to leave as well, where the doctors did their rounds. So there was a lot of time where I had to be away from her. Also, because of the HELP syndrome, I lost my vision. So my first sight of her, I couldn't see her. I literally remember a core memory of me just putting my hand in her incubator, counting her fingers and her toes, and I was like, she's perfect. Everything else will fall into place.
Yeah, and that's what this article talks about, how, advances in research have proven And so now you have an opportunity to bond. Than before, the practice was less sensory in the NICU, but now we know that there's a benefit to that bonding. Anyone else want to comment on that? Because it's
I would
very
say for
important.
me, again, with health syndrome, I was in the ICU for 3 days. I had not had sight on my son yet. But the moment I got to that incubator, it was just, they would allow me to touch him. I sang to him before I left every day. I prayed. And then it wasn't until a month later, I actually got to hold him, what is called kangaroo care, skin to skin touch. It was on Mother's Day. I will never forget. My first Mother's Day gift was holding my son. So just they always allowed that, and they encouraged it, that skin to skin touch, and allowing me to, touch him, be in the incubator, um, be there. I was still working and having to leave the NICU, but whenever I was there, it was always allowing that, making me feel like a mother and bonding with my son.
That's great. That's great. So that bonding, how would you say the medical team supported you in that bonding?
Absolutely. They were they were nurses, but I call them my auntie nurses. They knew I was a first time mom, so they would like allow me to change his diaper, teach me how to do that through the incubator, how to do his feedings. It became more so not like a hospital to me, but more like this is my son through the 3 months. And I became into that role as a mother, where I was detached from him for those days and not allowed to hold him. And then after all of that, he was mine. It felt more not like a hospital, but he's my son, and I'm here to care for him, and he's feeling my energy and feeling my touch and my body.
Yes, yes. Um, so that's so important. And I know that it made a difference for you and for your son. And I'm sure for the nurses as well to see you make that connection with your baby. And so I'm pretty sure that it wasn't just the effect between you and your son, but it was a inclusive effect for the entire team. Um, and we appreciate the importance of the support of the medical team, but we all know that support from our circle is very important as well. So, ladies, can you share what kind of support did you receive from your partner, your family, your friends during your NICU experience?
Well, for me, when everything was happening, I know I was screaming to my husband, call my mom, call my dad. And they took the first flight out and they were there. I had my in laws, I had my girlfriends there. Every step of the way, they were booking hair appointments for me, um, reminding me to self care. Um, I had a strong support system, and I don't know how I would have done it without them. Especially my husband, who's strong faith, optimistic. When I see spilt milk, crying, my husband sees we're going to find a way. So yes, my network was very strong, and I am so blessed to have him.
That's wonderful. Anyone else want to comment on that question?
I agree. I also had a great network, had family come in. You have a limited number of individuals who can visit the NICU, but those who could, grandparents, was there as well. I missed out on the baby shower. So, upon my daughter finally coming home, my family threw me a huge baby shower and pretty much provided everything she needed. I had family members come and clean my home because the day I went into the hospital, I threw up over my entire house. So I had to have, family members come in and clean, for us before we came back home. So they was definitely very supportive.
That's great. And so, this strong support network, I'm sure you can comment on the impact that they made on you and your family as you went through this time. Um, how important was that to you?
Very important. I mean, you feel like you're alone sometimes going through the process. As it was stated, you question, why is this happening to me? Why is this happening to my baby? So you definitely need that support so that you don't feel like you're going through the process by yourself.
Right. So we talked about the medical support and the bonding. Did you feel heard or supported by the medical team during your time there in the NICU with your baby? Can you give any examples of, that support, or if you didn't feel heard or supported, can you share any experiences um,
I think I think
as
for
it relates to
myself,
that?
I didn't feel hurt early on. Prior to developing HELP syndrome, um, I blew up. I was very swollen. I remember, talking to my OBGYN and just saying, am I supposed to be this big? Is my ankle supposed to be this swollen? And, he was just telling me that's normal part of pregnancy. It happens. And literally within a couple of days later, I'm in, the emergency room. So I felt like, sometimes as Black mothers, we don't always get heard when we are speaking of things that we're experiencing. However, once in the NICU, they were amazing. Everyone was amazing. From start to finish, the doctors keeping me informed, the nurses helping me down the hall because I couldn't see, assisting with kangaroo care, sneaking me in during times when I wasn't supposed to be there. They were amazing. Absolutely amazing.
That's wonderful. Anybody else
I
want to
think for
comment?
me, I thought the nursing staff and staff that helped were phenomenal. There was an instance when my son initially went in when they were giving him formula, and that kind of shook me because I had a plan in my head to like breastfeed and all of that. But just to make sure that he was healthy and that things were progressing for him, I just kind of had to let that go. But other than that, I think my NICU stay was phenomenal care.
That's good. Okay, so let me chime in and bring
I
Miss
was,
Pearlie in as a nurse, as a NICU nurse. I have a question for you.
yes, ma'am.
What resources do you all provide for NICU parents as they are, um, you know, living this life in the NICU
So
and having this
thank you
journey?
so much for chiming in. First, ladies, I wanted to say thank you for sharing your stories. I've actually been retired out of the NICU for about 5 years now, and you ladies have just brought me back in there, and how beautiful and amazing it is to have been a part of this world with the NICU. So I worked in a special area. I was in the military hospital, so we had multiple resources for our parents and supportive family members. We also had a room where parents could stay over if they wanted to. Just mom and dad was allowed, and we didn't allow the baby to go into the room until they were ready to graduate to that level. But we had that option if they wanted to spend the night with your baby, before you went home, to make sure everything went okay and you were comfortable. Sometimes we do 2 to 3 nights just in case your baby was going home under monitor or something like that, so that you were taught and understand and feel comfortable for that. So we provided those resources, and a huge advocate for skin to skin care, for any time that you can have with your baby. We advocated for that, even if they had lines in, IVs, or oxygen. Any way that we could get you to be next to your baby was always something that we advised. And I'm so grateful to hear this side of the ledger, that we didn't realize how much our role is in advocating for that. So I thank you ladies so much for that, because we just stepped right in knowing that it was necessary to give us ourselves to you and your loved ones as much as we could. So it was very personal to us, to me. I saw the babies in the NICU as if they were my own. You know, some of you moms may have experienced that the nurses in the NICU were very protective over your babies, because they were like a journey for us too. And we loved having you guys there. We love the experience going along with that with you guys, and anything that we could do to make it a better transition for you, we did that. And there are still babies that are now 10 years old, 12 years old, that we have a reunion still every year, at the military hospital, Fort Bragg, North Carolina, where I retired out of, for all of the NICU moms and the kids. And I still keep in touch with them. So it's a lifelong relationship that develops right there, to some of them becoming like family members to us. So I appreciate your support. I appreciate you guys sharing your story. And I thank you for allowing us as NICU nurses to be a part of that. Thank you.
Wonderful, wonderful. And I hear your passion and your love for these NICU moms and for their children. And, you know, having worked with NICU nurses throughout my career, I see that passion day in and day out. And it makes a difference. It does make a difference. And it brings joy to everyone involved in the care of these beautiful babies. So thank you for your service as well, and all that you've done in this space. So let's transition a little bit and talk a little more about research. So research helps with reducing disparities, right? Moreover, life-saving and life-preserving interventions exist because of research. There are numerous research studies in the past, present, and in the future that can fuel advances in neonatal care. And as NICU moms, as Mocha moms, as medical professionals for some of us, do you think about medical research, or did you think about medical research during your NICU stay? Can you share your interest in research or participating in research? Can you speak a little bit about that?
Well, I would say for me, because I did have the medical background, I did want to, it wasn't my specialty, but I wanted to engulf myself in it and understand the process on the medical side, but still want to be a mother. So there was a book that a nurse recommended to me called Preemies, second edition. And I read this book daily, highlighted it. It gave me so many answers to the questions I was having, since my medical knowledge of it was just very broad and not in depth in NICU, and so I read this book daily, and it did help me on this course. What scans they were doing and why they were doing this blood work, and even after the NICU outlook, what should I expect? So I did. Dive into research and did read and try to familiarize myself with the medical background and research about NICU babies.
Anyone else want to comment on research and its importance as it relates to you and your experience as a NICU mom or a NICU nurse?
I would, if there's not a mom. Is there a mom who wants to talk? Yeah. So we, as a nurse in the NICU, we were constantly involved in medical research and up-to-date advantages and care for the NICU babies. We had to be prepared for whatever came in the door, and we had to stay abreast of all of that. I personally was in charge of the infection control division in the NICU, so I held weekly hand washing sessions, infection control practices with family members, and when family members would bring their other children in. So I personally would show them just something like how to simply wash their hands. Because you may remember you had to do that for probably about 3 minutes outside of the NICU, and sometimes you'd have to gown up. So we would always stay abreast, mostly of infection control practices, to protect the immune system of your baby that was born before it was time. So we were always having those discussions, and I will say, me personally, every single time a mom or a dad or a family member came in with mom and dad's permission, that we were always educating, always giving you any information. I always sat at the bedside with mom and dad and family members, to give them any type of information they needed, the latest research, the latest updates, everything that we were doing with their baby, always keeping them informed of everything and answering their questions. It was just a really, really special bond to be able to be one of those advisors to do that with the families. Thank you.
That's great. That's great to hear. And we know that, we're involved in research as medical professionals, and that research helps improve outcomes,
Yeah.
and helps, the babies come home and have better outcomes and come home sooner. So it's very important for us to, do research and understand what's happening with the babies as they are growing, and all of the new medical technologies. And so we want to applaud all of you all for your interest in research, and continue to encourage you to do that. And with the advances in medicine, many more NICU babies are able to go home with their families sooner and have more improved outcomes. So I know that this was a very exciting time for you all when the time came to bring your baby home. And as a former NICU mom myself, I am a pediatrician, but my 18-year-old now son, who was a full-term baby and had to stay in the NICU for 5 days. So I am also a NICU mom as well. So I'm double duty tonight. And so tell me, how did the NICU team prepare you to take your baby home, including any special care needs? Can you share anything about that journey, preparing to take your baby home?
For myself, I had special classes. I had an apnea machine I had to go home with, which told me if my son stopped breathing. So I had training for that. We had CPR training. There was a list of specialists my son needed. He had kidney disease. He had lung issues. So they had mapped out, referral lists and specialists who I should see. I felt very prepared, but again, scared at the same time. But I felt the hospital tried their best to equip me with what I would need going home, caring for a son coming out of the NICU.
My son only stayed a week. On that 6th day, they called and said he was ready to go home. And when I got there, his temperature had spiked. So they actually asked to keep him an additional day. So that was emotionally taxing because I was preparing for him. But once I came back the following day, he was ready. And the only thing that I remember is them making sure that we knew how to get him in his car seat because he was so tiny. So they made some provisions for us to make sure that he was secure and that he was safe on his way home.
And so what was one of your biggest concerns bringing him home?
For me, just the emotion of it all. I had, as I stated before, this was my first living child, but I had been through a pregnancy prior. So I think all the emotions kind of came in at once because my first pregnancy, I birthed my son, he was stillbirth. So stillborn, so I had to leave the hospital empty-handed. And as a NICU mom, I still left the hospital empty-handed at first. But that day I finally got to bring him home. It was just like a wave of emotions that kind of came over me. I was excited, I was nervous, a little bit anxious, but it felt good to actually be able to finally bring my baby home.
Yes, yes. Anyone
From
else?
Sure, from the medical side, I will say that education for preparing for your baby to go home started from the very beginning. When your baby came into the NICU. I am always, or most of the nurses and the medical team will, in a way, start to prepare you for that by making sure that you have everything that you need at home, or what resources you need, or what support you need, what to expect when they're to come home, how long that might be, give or take, whatever the situation may be, based on your baby's circumstances as to why they're in the NICU. I will say that I know we're all women of color here, that babies that were of Mocha magic tend to do better than ones that were not. So it was, I would have those candid conversations with each individual family member about what to expect for their baby based on the whatever their pregnancy was, and why their baby was in the NICU. So it started from the very beginning and into the time of discharge, and we were still there as a resource if you needed assistance when you were discharged. We had triage numbers, we had lactation consultants. So, and of course, as I've told you before, I still am very much in touch with some of the children and the moms. I have one that is surprised, she's going off to college this year. So it's really, really just, it starts from the very beginning.
And that's so important for that to start from the beginning, because it helps the parents feel equipped to care for their babies once they're home with them. And they have that connection because they feel like they've been educated about how to care for their child, and they feel empowered by that. So, and I'm sure all of you ladies felt um, that empowerment. And we know that, you all are doing this work because of your lived experience, your passion to help others through the process, and commitment to participating in fielding medical advances in neonatal care. And we really applaud you for your efforts. Can you tell us what success have you seen as a result of the NICU work that you've been doing?
Well, I don't work in the NICU field, but I will say that I do participate with the organization um, March of Dimes. So it just seeing my son go through this journey, and then now being connected with March of Dimes, he understands more about what he's gone through, and he appreciates um, how he's overcome. He understands the magnitude of how he's a miracle and blessed to be here. So um, it may not be that I'm in research for the NICU field, but I'm still very much involved, and I try to teach my son. So definitely it gives him confidence knowing, I've overcome this. I can continue, during disabilities he still has as a NICU child born so early. He still fights through anything. So I will say that just staying involved helps my son build confidence.
That's great. That's great. Anybody else want to comment on the work you've been doing, your advocacy, and your success in that?
I can chime in again.
Mhm.
The work I volunteer still now on different NICU panels. We actually just had, through the Zeta Phi Beta chapter here, they had a NICU session where it was career day, and we talked about NICU from a respiratory side and a medical side to the young girls, ages, I believe they were 11 to 15. Um, we spoke to them on career day about NICU and a career in the NICU as from a medical standpoint. So I volunteer to do that quarterly with those with younger girls just like us to see, so that they know. Also, I volunteer with an organization called I Will Survive, which has some moms that are part of that organization who had developed breast cancer. So it's a breast cancer survival organization, nonprofit organization. But there are a lot of moms that I've come across that had spent time in the NICU. And so just supporting them in anything that they need. And I still am a resource as a licensed lactation consultant as well. So I will help moms with that and encourage anyone if they have any questions or they need anything where I can get them in the right direction or connect them with who they need to be with.
Okay, that's great work. I applaud you for that work and your commitment to
Oh,
um, this area. It's great. So, from a personal perspective, ladies, how has the experience in the NICU affected your parenting style? Can you comment on that?
I think for me, definitely it made me a helicopter mom. I wanted to be, on top of and involved in everything that was going on. Probably a little bit too much. I'm definitely more lenient with my younger kid, but my oldest daughter, I was on top of her like white on rice.
Mm-hmm. Mm-hmm.
Absolutely.
Yeah. Others have that sentiment.
Absolutely.
Yeah, I think when I got home, I was very protective of him. He's almost 8 now, so I've
Yeah.
kind of loosened the reins a little bit, but for sure, those first few months where I was very protective.
Yeah. Yeah. I can understand. Do you think your baby's NICU stay has had a long term impact on um, his or her development?
I would say no. My daughter had some issues when she was younger, but she's 21 now. She is a senior nursing student at Kennesaw State University, and she's doing amazing. She's always on the dean's list, honor roll. She is an overall great human being. So I would say absolutely not.
Okay. Well, that's great.
great to
That's
hear.
great. Anyone else want to comment on that question?
We've outgrown all the health challenges. There's no more hospital stays and nebulizers and oxygen machines and kidney disorders. But we do still have the learning disabilities. Just the amount of time his brain was out without oxygen, he had a small intracranial bleed. So that did impact his learning, but he's doing great. We celebrate small wins. I don't dwell on that. He's healthy. He's a vibrant, absolutely amazing 10-year-old.
That's wonderful. That's wonderful. So, ladies, and this is our final question. What advice would you give to new NICU parents about managing their expectations and emotions? And I'd like each of you to maybe comment on that question briefly.
Hold on to hope. It seems like despair. Celebrate the small wins. If you're, for me, if he had 1 minute sucking a bottle with breathing and learning how to swallow, I clap for that. If I was able to put clothes on him, I was celebrating that. And even now, with his challenges with learning, if we make honor roll 2 times out of the year, I applaud him for that because I know he's still fighting. So, no one wants this for yourself, but if it does happen, engulf yourself in research, be knowledgeable, but just try to be a mom first and be there for your child, celebrate them, and know that there is light at the end of the tunnel.
That's great advice. Anybody else want to chime in?
I would say to just take a moment to breathe. The whole process is very overwhelming. But we are our first line of support for our babies. So if we're not together, they're not going to be together, and they can sense when, we're off. Definitely during that kangaroo care time is when her heart rate was best, her breathing was best. So, take a moment to breathe. It is overwhelming, but you know, you'll get through it.
I would say
Wonderful.
give yourself some time, journal or just get it out. If you have somebody that is supportive of you that has a listening ear, prayer definitely works. And I would use music as therapy for me when I was away from my son, just to kind of encourage me so that when I was in his presence, that I can just be encouraging with my presence there for him. So take care of yourself, give yourself grace.
That's great. Nurse Pearlie, can you
I
give any
love,
advice?
yes, ma'am. Thank you. I love all of those answers. It's such a privilege to be on this side of the ledger for you moms. I would say to all of the NICU moms that we are here for you. Don't hesitate to ask any questions. Don't hesitate to be involved in the care of your baby's care. Just being in the NICU, it is challenging. There's a lot that goes along with that. It's scary, but we are here for you. We're here to support you before your baby is born and after you go home. So I want all those moms to know that we are here for them, and every step of the way there's someone in the NICU that's going to be there for you. It's a 24/7 operating system, and we are there for them. So we just want you to know that your baby is always in good hands.
I can't think of a better way uh, to transition into our Q&A session. Thank you all, ladies, for all of the things that you do for the NICU, for the NICU moms, and for your own children. Now we're going to transition into our question and answer session. If you have any questions, you can put them in the chat and we will try to answer those questions. Okay, we have a question. Do you think about how medical research and previous clinical trials impacted your child's survival? Can anybody answer that question?
Well, I had my child at a teaching hospital where I actually did my PA degree at. It wasn't a hospital I was supposed to deliver at, but when my medical emergency happened, that was the closest hospital. So I felt the research and knowledge those residents and doctors had was key in early diagnosis of health. And maybe at another hospital, they would have sent me out the door. But they were very in tune to what was going on, even though I wanted to leave. I didn't want it to happen. They were very in tune to, what was going on and the severity of the actual health syndrome and the event that was happening. So I was kind of fortunate to be at a teaching hospital when all this occurred, and a historically Black college and university and my PA school where I attended.
Thank you for that answer. Continue to put your questions in the chat. If you have any additional questions, please put them in the chat. We have another question. Does doula support make a difference in care outcomes and provider treatment? Anybody want to tackle that question or comment?
Uh, I I can if I'm coming off. I can. I think that from the medical perspective, the doula support did make a difference. We didn't have a lot of doulas in the teaching hospital, military teaching hospital that I worked in, but there were some family members and moms that did share that support did make a difference in their outcomes because it helped prepare them for when and if they were going to go into the NICU. And sometimes that did happen. So it helped them prepare mentally, not exactly how things would turn out, but it helped prepare them should that be in, the situation if their baby ended up in the NICU. So I personally didn't work with a lot of doulas, but that was shared with me that it did help make a difference in the outcomes for their treatment.
Thank you for that. This is a next question. Are there any steps that high-risk moms can take to advocate for themselves in prenatal and postpartum care that you recommend?
Sure, I can answer that question. If you'd like to too, that's fine. I would say speak up, ask questions, be an advocate for yourself and your baby. Just as you were saying earlier, Machina, that sometimes moms, Black moms especially, they're not heard very well. So continue to advocate for yourself, um, and ask questions. Stay diligent about what it is that you feel, and be conscious of that. So continue to advocate for yourself and your baby.
I agree with that. Advocacy is very important, and sometimes it's good to have someone with you to help be your advocate. And
Yes.
so, if you are a person who doesn't have, you may not have medical knowledge, but you may have, someone in your family, you may have a friend who is a medical professional who can accompany you to your visits or who can be there with you in the hospital room to be an advocate for you because you may not know the right questions to ask or so always if you know don't feel that you are understanding, always ask questions, or if you have someone that can advocate for you and with you, definitely bring someone along that could help. The next question: is it true that NICU babies can have speech delay issues?
My son, well, he was 3 months early, so we had a lot of developmental delays, and speech was one of them. But early intervention is so key with preemies born that early. So we did have a speech therapist, occupational therapist. There were a lot of therapists early on in our home helping my son, and we no longer have to have that speech therapist, but it is common, I would say. Well, for myself.
I would say that it depends on the situation with how early your baby was born, if there were any other congenital anomalies, or if it just depends. Every baby and mom situation is different. I will say that early intervention is key, and we have all of those resources. Like I stated before, education and care starts from the very beginning. And your family and mom and dad being there to advocate for those things is very important too, to make sure that those things are corrected early on. So it just depends, but I have seen that, and early intervention is key. I will say that many of the children that I'm still in touch with the families, that they're doing amazing. They're excelling very well. And most of the babies tend to not have any issues later on. I have seen things like asthma, but there's also contributing factors for that. Just depends, but not really any speech delays later on.
Any other comments regarding speech delays? And I can comment as well about that. Um, and as Ms. Pearlie said, it depends on the condition of the patient of the baby. If they have delays in their services, early step services that can help with those things as well. I don't think we have any more questions. I will turn it back over to Ms. Martin. I want to thank you, ladies, so much for sharing and for all that you're doing in this space of NICU. Thank you for being here, all of you all. And I'll hand it back over to Ms. Martin.
Thank you so much, Dr. Williams, and to all of our participants, Michelle, Shanika, Shay, Alicia. We are so thrilled that you chose to share your stories with us this evening. One thing that I wanted to mention is that all of the women on this call are considered blessed because you got to bring your babies home. Let's make sure that we keep the thoughts and prayers of the mothers and the families who don't get to bring their babies home, because we know that that is a real existing fact that happens today, right now. So let's make sure that we're keeping them all in our thoughts and prayers as well. As we proceed to end this session, I want to remind you that we do have all of our previous All of Us medical research events here: maternal health, mothers of color, and family health, history, and heritage. Make sure that you scan that QR code. And then you can also scan the QR code here to make sure that you're following Mocha Moms on all social media platforms. It has been our absolute pleasure to host you this evening. Have a wonderful, wonderful night. Good night, Mochas.